Are our COVID hospitals safe? Is there a need for increased security in the COVID wards? Can the already overworked doctors be left at the mercy of the mob in these times of pandemic? Angry family members of a COVID patient who expired at Imphal JNIMS hospital last night vandalized hospital property including ventilators and other life-saving equipment as well. The patient passed away at the COVID care ICU of JNIMS. The family members alleged negligence on part of the doctors and vandalized hospital property. The deceased has been identified as 33-year-old Okram Gypsy, wife of Okram Ajit from Singjamei Wangma Kshetri Leikai, Imphal. The deceased was admitted at hospital on May 23rd, and as per the CCTV footage accessed, Okram Tanu, sister-in-law of the deceased, and Okram Ajit, the husband, were seen vandalizing hospital property there. This is not the first time that frontline workers and hospitals have been at the receiving end in the region. Well, viewers, earlier this week, a young junior doctor was as well brutally thrashed in Assam's Hojai district after a COVID patient succumbed to the infection. While speaking to Northeast Live, JNIMS director Dr. Bhimo narrated under what circumstances the patient succumbed to the virus, besides narrating the subsequent incident.
One 33-year-old lady, which is the wife of one Okram Ajit, died suddenly after struggling for hypoxia in the ICU of the COVID-3 JNIMS. Even though she was trying to be safe by all our healthcare personnel, day and the night, 24 hours in the ICU, her oxygen saturation could not be improved very much because her lungs was already damaged to the extent of 90 to 95% is available from the X-ray test. Not only that, her oxygen saturation was also not improving. In spite of all these efforts, unexpectedly, she had a sudden cardiac arrest, as has been reported by the treating doctors yesterday, and in spite of trying all the best, she succumbed to death. Subsequently, husband was having emotional breakdown and reacted, causing damage to the equipments like ventilators, monitors, trolleys, and also oxygen flow meters.
The police, meanwhile, have arrested the duo. An FIR has also been filed in this regard. Well, Dr. Bhimo informed that the husband, who is in police custody, has tendered apology for the incident and also offered to bear the expense for the damage.
A complaint was lodged to me from the treating doctors and the groups, and I have submitted it to the concerned SP of the Imphal East, and the Imphal East OC has taken necessary action and kept the relative, that is the husband and the one relative, to their custody from last night. There was a request from the relatives of the patient, and our whole team of the doctors, that is the MOs and the faculties of the anesthesia department who are handling the ICU, came, and we discussed together with the request from the patient party, that is the husband who is in police custody, and after discussing his audio as well as written documents which he has submitted with an apology, and also giving assurance to repair or replace the damaged equipments, I mean, it was agreed on humanitarian ground that let us bring an amicable solution.
And it was also stated that the JNIMS authorities may withdraw the FIR on humanitarian grounds now that an apology has been made in this regard. Meanwhile, apart from the medical fraternity, UCM Secretary General Khuraija Mathoba also condemned the incident.
It is really unfortunate that yesterday a lady was succumbed in the COVID ward at JNIMS Hospital in Imphal. On the other side, it is also even more unfortunate that the victim's family has violently reacted to the working staff, including the doctors, destroying various hospital equipments like ventilators, which is important for saving lives during this pandemic time. And I think such acts should not be committed by any of the patient party in future. Of course, we do understand that losing an important life from our family member is never going to be easy. So I humbly appeal that let's all join hands and work together, as we have seen many important lives, losing from our society and due to this COVID, and we cannot avoid it, no matter how hard we try. I finally appeal to every doctors community and patient party to be more cooperative in our approach towards each other during this trying time.